Everyone reads medical books together. This is a medical book published in the UK in 2025. The title is Reversion of Disease and Aging, Healthy Medicine. This chapter is 4.3 Conditioning of Body as Healthy Medicine, Clinical Trials. Conjoined old and young. The anti-aging secret discovered over a century ago? Hello everyone. Today, I want to share with you an amazing science experiment that you've probably never heard of. Conjoined old and young, heterochronic parabiosis. It sounds a bit like science fiction, but this research is actually more than 100 years old, and it reveals something astonishing. Aging can actually be reversed. What is a parabiosis experiment? Simply put, scientists surgically join two mice together, so they share the same blood circulation. If the two mice are the same age, that's a typical parabiosis experiment. But if one is young and the other is old, this is called conjoined old and young, heterochronic parabiosis. The goal is to find out, can young blood make the old become young again? Can old blood make young blood age? Why is blood so important? As early as 1878, the scientist Claude Bernard proposed an important concept. Our cells actually float in an internal environment called extracellular fluid, and the stability of this environment determines our health and overall life condition. This internal environment includes the circulatory system, blood, and extracellular fluid. So, if the circulatory systems of two animals are connected, this allows us to directly observe how factors in the blood influence each other's health and aging. The amazing discovery of conjoined old and young. The research findings are truly astonishing. 1. Old becomes young. After connecting old mice to young blood, stem cell function in the liver, spinal cord, and brain improves. Muscle regeneration ability strengthens. Cardiac hypertrophy improves. Kidney inflammation decreases, and autophagy function improves. Overall organ function is rejuvenated. In simple terms, the mice became younger and healthier. 2. Young becomes old. But on the other hand, when a young mouse receives blood from an old mouse, muscle regeneration worsens. Nerve cell formation decreases. Overall function declines. In other words, aging factors really exist in the blood. Why does it become young? Scientists believe there are two simultaneous effects in the conjoined old and young. The old mouse receives health factors from the young blood. The old mouse transfers its own aging and unhealthy factors to the young mouse. It's like this, replenishing nutrition while detoxifying, creating a beneficial cycle or a double anti-aging cycle. This is why mice exhibit a phenomenon of reversing aging in their bodies. Can humans do this? The answer is no. Humans can't perform conjoined surgery like mice, so this method currently remains limited to animal studies. But these studies offer an important insight. Factors in the blood could be the key to future anti-aging medicine. The conjoined old and young experiment shows us aging is not completely irreversible. The body's internal environment or extracellular fluid is more important than we realized. Future anti-aging medicine may make breakthroughs by adjusting blood factors. Although humans cannot undergo conjoined experiments, scientists are working hard to find out which factors speed up aging and which ones can rejuvenate the body. These studies could become the real age-reversal medicine of the future. Heart conditioning. Why can a small stimulus make the heart stronger? Did you know? The heart is actually like a muscle. Mild stimulation can make it stronger and more resilient. Today, I want to share a very important concept that most people don't know about. Cardiac preconditioning, heart conditioning. It's considered a true form of preventive medicine and is even believed to have the potential to reverse disease and aging. Sounds amazing, right? Let's explain it clearly. So what exactly is cardiac preconditioning? Simply put, giving the heart a little brief, controllable mild stress can actually make it stronger, more resistant to ischemia, and less likely to get injured. This kind of mild stress triggers a series of protective mechanisms in the heart, as if the body is saying, oh, there might be danger, so I better get ready. This idea is similar to the research on conjoined old and young individuals. Both activate the body's repair and protection through the extracellular fluid, the blood environment. How did science discover this? In 1986, scientist Murray performed a classic experiment. He briefly blocked the animal's coronary artery. 4 or 5 minutes, then released it, blocked it again, then released it again, and repeated this cycle several times. The results showed. When the heart later faced a longer blockage, the damage was surprisingly less severe. Subsequent extensive research confirmed that cardiac preconditioning can reduce the damage from myocardial infarction and decrease the occurrence of arrhythmias, reduce cell death, improve heart contraction function. In other words, a brief episode of mild hypoxia actually helps the heart better withstand a real, severe hypoxia. Is this really effective in clinical practice? The answer is yes. It has been proven helpful in the following situations: patients undergoing cardiac catheterization, patients undergoing heart surgery, people with coronary heart disease. There is even a type of indirect cardiac preconditioning called remote ischemic conditioning, or RIC. Place a blood pressure cuff on the arm. Inflate it to 200 millimeters of mercury, blocking blood flow, for 3 minutes, then release it. Doing this can actually protect the heart, reduce damage from myocardial infarction, lower major cardiovascular events, even lessen the severity of stroke. Isn't it amazing? Why can mild stress make the heart stronger? When the heart experiences brief mild ischemia, the body activates a series of protective responses. 1. Release of healthy factors, including activation of the sympathetic nervous system, activation of the RAS system, increase in nitric oxide, NO, increase in protective proteins, activation of repair and remodeling mechanisms. All of these help make the heart more resilient. 2. Eliminating unhealthy factors. For example, free radicals, damage caused by ischemia reperfusion, cell apoptosis, cell death, metabolic waste. At the same time, it also enhances autophagy, the cell's cleaning process, making heart cells cleaner and healthier. 3. Overall effect. The heart becomes tougher and less prone to damage. It's like this. Muscles get stronger through training. The immune system becomes more responsive after stimulation. The heart also becomes stronger after mild stress. This is the essence of cardiac preconditioning. Paragraph 5. Benefits beyond the heart. The whole body gains. Research shows that cardiac preconditioning not only protects the heart, but also shields brain, the lungs, kidney, intestines. It can even reduce damage from low oxygen, toxic injury, hemorrhagic shock, kidney injury caused by contrast dyes. In other words, this is a whole-body protective mechanism. To sum up, cardiac preconditioning equals giving the heart a small, controlled dose of mild stress triggers protection, makes it stronger. It can reduce the risk of myocardial infarction, reduce the risk of sudden death, minimize stroke damage, protect organs throughout the body, and it may even slow aging. This is the body's natural self-optimization mechanism. In the future, scientists may also use this principle to develop more strategies for preventing disease and slowing aging. Lung conditioning. Why does catching your breath first actually protect your lungs? Have you noticed that some people start exercising feeling out of breath, coughing, or even experiencing chest tightness? But after a short while, they actually breathe more easily and feel less breathless? Actually, this is not an illusion. This is a scientific phenomenon called lung conditioning. It's very similar to the idea of cardiac preconditioning. Giving the lungs a little brief mild stress can actually make them stronger and less prone to injury. Can the lungs also get stuck? What exactly is bronchospasm? Our airways are like elastic tubes that can tighten and relax. When they suddenly contract, they become narrower and tighter, making it harder for air to flow through. This condition is called bronchospasm, commonly seen in asthma, shortness of breath after exercise, allergic tendencies. When bronchospasm occurs, you may experience chest tightness, coughing, rapid breathing, wheezing sound. These are all caused by airway narrowing, inflammation, swelling, and increased secretions. Why does exercise cause the airways to narrow first, then relax? Research shows exercise for 4 minutes or less usually does not trigger airway spasms. Exercise for 8 to 16 minutes most likely to trigger spasms. 30 to 60 minutes later, symptoms naturally ease. Even more surprisingly, if you exercise again within 60 minutes after the first spasm, the second time, the cramping is actually less and milder. This is called refractoriness. Warm-up effect. Running through effect. It means the first mild stimulus actually makes the airway more protected the second time. This is the core idea behind lung conditioning. Brief, mild stress can actually protect the lungs. When you do a short, moderate exercise session, about 16 minutes, the airways trigger a series of protective mechanisms. Boost healthy factors. The trachea becomes more flexible. Cardiopulmonary function improves. Release protective substances, such as prostaglandins. Reduce tracheal overreaction. Eliminate unhealthy factors. Free radicals. Inflammatory substances. Swelling around the trachea. Oversensitive neuropeptides. Overcontracted tracheal muscles. The result is, the lungs become tougher, less prone to spasms, and less likely to get inflamed. This process is like the idea of conjoined old and young, adding good factors while removing bad ones. Paragraph 4. Long-term exercise makes the lungs healthier. Numerous studies have confirmed aerobic exercise can reduce airway inflammation, lower the frequency and severity of bronchospasms, improve asthma symptoms, boost overall lung function and cardiopulmonary endurance. Animal studies have also shown exercise can reduce airway swelling, decrease inflammatory cells, reduce oxidative stress, prevent airway remodeling, hardening, and thickening. Simply put, the more you move, the healthier your lungs become. The less you move, the more vulnerable your lungs are. Can cardiac preconditioning also protect the lungs? Even more interesting, the heart's indirect preconditioning, RIC, can also protect the lungs. Research shows it reduces lung injury caused by hemorrhagic shock. It improves damage from lung ischemia reperfusion. It increases lung oxygenation capacity. It lowers pulmonary artery pressure. It enhances gas exchange efficiency. It's even helpful during surgery. Heart surgery, orthopedic surgery, lung resection, lung transplantation. All of these surgeries may have fewer lung complications thanks to this preconditioning. To sum up, lung conditioning equals brief mild stress triggers protection, lungs become stronger. It can reduces exercise-induced wheezing, coughing, and chest tightness, improves asthma, enhances cardiopulmonary function, reduces lung inflammation, decreases the risk of lung injury after surgery, may even delay lung aging. The simplest method is regular aerobic exercise, a brief, mild warm-up before exercising. All of these help make your lungs healthier and stronger. Gut conditioning. Why does eating less actually make your body stronger? Did you know? Scientific research has truly discovered moderate eating less or fasting can actually strengthen your intestines, boost your health, and even slow down aging. Today, we're going to talk about this idea, gut conditioning. So what exactly is gut conditioning? The core idea of gut conditioning is simple, giving your intestines a little nutritional mild stress, which can activate your body's protective mechanisms and make your intestines healthier. This mild stress usually comes from calorie restriction, eating less, intermittent fasting, regular periods of not eating. Both methods can activate the intestine's self-repair mode. What is calorie restriction? Calorie restriction is not about starving, but about eating 10% to 30% fewer calories every day, while still getting enough nutrients. Research shows animals live longer. Human health markers improve. Body inflammation decreases. Cognitive functions, memory, learning improve. Here's why. Cells become stronger and more resilient when exposed to mild stress. What is intermittent fasting? Intermittent fasting is a more intense form of calorie restriction, 1 to 2 days per week, with calorie intake reduced by 75% to 90%. Studies show improved insulin sensitivity, lower blood sugar levels, reduced blood lipids, lower blood pressure, reduced body weight and body fat, lower risk of heart disease. Similar health improvements have been observed during Ramadan fasting among Muslims. Why does eating a little less make your intestines stronger? The intestines are the main organ responsible for nutrient absorption. When you give your intestines a short rest or lighten their workload, several things happen. 1. Activate the cell's defense mechanisms. The intestines start to repair damaged cells, activate autophagy, cellular cleaning, reduce inflammation, lower oxidative stress, improve mitochondrial function, the cell's powerhouses. All of these help make your intestines healthier. 2. Creating healthy factors, including better insulin sensitivity, more stable blood sugar, healthier fat metabolism, improved endocrine regulation. These factors affect the entire body, including muscle, liver, kidney, heart, nervous system. When the intestines improve, the whole body benefits. 3. Eliminating unhealthy factors. For example, high blood sugar, high blood lipids, inflammatory substances, oxidative stress, risk of atherosclerosis, damage from myocardial infarction. These are all roots of chronic disease and aging. The connection between gut conditioning and conjoined old and young. The study on conjoined old and young you saw earlier pointed out. Health factors and plus unhealthy factors out equals reversing aging. Gut conditioning works the same way. Eat less, activate repair. Fasting clear out harmful factors. Stronger intestines, a younger body overall. This is why intestinal optimization is considered an anti-aging strategy. Could cardiac preconditioning also protect the intestines? Interestingly, cardiac preconditioning, heart conditioning, can also protect the intestines. Research shows mild ischemia of the stomach lining can protect the stomach. Blood from cardiac preconditioning can protect intestinal cells. When intestinal blood flow decreases after surgery, cardiac preconditioning can reduce intestinal damage. This means the intestines also have a preconditioning effect, mild stress, major protection. To sum up, gut conditioning equals eating less plus fasting plus mild stress activates repair, stronger intestines, better overall health. It can reduce weight and body fat, improve blood sugar, blood lipids, and blood pressure, reduce inflammation and oxidative stress, lower the risks of heart disease and cancer, improve kidney function, slow down aging. In the future, gut conditioning could become a long-term, sustainable health strategy. You might have heard of heart conditioning, lung conditioning, or gut conditioning. But did you know? Actually, our entire body, 10 organ systems, can all be conditioned together. This concept of whole body conditioning could be the true key to reversing disease and slowing aging in the future. Today, we'll use the simplest way to help you understand whole body conditioning, why it can make your body feel younger, how it connects to ancient wellness wisdom. Our body is made up of 10 systems. The human body isn't just a single machine. It's a big team made up of 10 systems. Nervous system, cardiovascular system, respiratory system, digestive system, urinary system, musculoskeletal system, immune system. The endocrine system, reproductive system, and skin system. Each system influences and relies on the others. What is whole body conditioning? You can think of whole body conditioning as the process of getting the body's 10 systems into their best condition. Just as the heart can become stronger through cardiac preconditioning, the lungs can become more resilient through a warming up effect, and the intestines can become healthier through fasting. In the same way, other systems can also improve with moderate stimulation, stress, or training. Activation, adaptation, repair, protection, compensation. These are all abilities our bodies are naturally equipped with. How does whole body conditioning help the body stay young? The core principle of whole body conditioning can be summed up in one sentence. Add healthy factors, remove unhealthy factors. When the body experiences moderate, controlled small stressors, like exercise, fasting, or exposure to cold and heat, it triggers a series of protective mechanisms, enhancing cell repair, reduce inflammation, lower oxidative stress, improving metabolism, boosting immunity, enhancing organ function. These effects happen simultaneously in the heart, lungs, intestines, kidneys, muscles, and nervous system, ultimately forming a whole body positive cycle. This cycle closely resembles the findings of the conjoined old and young study. The body's environment becomes healthier, cells become younger, organ function improves, disease and aging are reversed. Whole body conditioning is not a drug, but a natural physiological response. Here is a very important idea. Whole body conditioning doesn't depend on medicine, but on the body's own abilities. It's a kind of adaptive stress, hormetic stress, mild stress. It promotes major protection. For example, exercise is adaptive stress for muscles. Fasting is adaptive stress for the intestines. Exposure to cold and heat is adaptive stress for immunity and metabolism. All of these help make the body stronger, more resilient, and younger. This has actually been known in ancient medicine for a long time. Over 2,000 years ago, the famous Eastern Han physician Zhang Zhongjing said, "The three main goals of medicine are treating disease, saving lives, and healthcare, preventing disease and aging." Chinese philosophy also teaches that life goes through birth, aging, sickness, and death, but we can delay aging through wellness. Science now confirms that mild stress, heart conditioning, and gut conditioning, whole body conditioning, can all activate the body's repair and anti-aging mechanisms. In other words, the ancient wisdom of wellness is being validated anew by modern science. To sum up, whole body conditioning equals strengthening 10 organ systems, together reversing disease, slowing aging. At its core is mild stress, activating the body's self-repair, boost healthy factors, eliminate unhealthy factors, bringing the body back to its best condition. This is a true form of preventive medicine and an important path for future health and longevity. Whole body conditioning and preventive medicine, clinical evidence. Indirect cardiac preconditioning, protecting the whole body's organs without surgery or drugs. Did you know? Just by doing a simple blood pressure cuff inflation exercise every day, you can actually protect your heart, brain, kidneys, lungs, intestines, and even slow down aging. This method is called indirect cardiac preconditioning, remote ischemic conditioning, abbreviated as RIC. It involves no drugs, no injections, and no surgery. Yet it activates the body's own repair mechanisms and is regarded as a true form of preventive medicine. What is RIC? RIC is very simple to do. Wrap a blood pressure cuff around the arm. Inflate it to 200 millimeters of mercury, blocking blood flow, for 3 minutes. This kind of brief ischemia reperfusion stimulus activates the body's protective mechanisms, which not only protect the local tissue, but also help safeguard distant organs. Which organs can RIC protect? Research shows that RIC can protect heart, reduces damage from myocardial infarction; brain, prevents and repairs stroke; kidney, reducing acute kidney injury after surgery; lungs, liver, intestines, and skin, reducing ischemic injury. Even in cases like heart surgery, coronary interventions, and stroke, clear protective effects can be observed. RIC benefits for the brain. RIC not only protects the heart, but also the brain. Research shows stroke prevention, supports recovery after stroke, promotes neural repair, nerve regeneration, blood vessel regrowth, synapse formation, reducing inflammation and mitochondrial damage. May also help with brain hemorrhage. This means RIC is a neuroprotection strategy with great potential for brain health. Benefits of RIC for the kidney. About 30% of heart surgery patients experience acute kidney injury. However, research has found RIC can significantly reduce this risk, protect kidney function, and improve postoperative outcomes. This makes RIC a simple and effective kidney protection method. The long-term effects of RIC are even more impressive. Not only effective in the short term, but long-term practice of RIC also delivers amazing results. Studies show doing RIC daily for 6 weeks improves heart function and heart rate variability. Doing RIC daily for 1 year reverses heart remodeling and improves cardiovascular function in heart failure patients. Patients with enlarged hearts experience reduced heart size with no side effects. All these results demonstrate RIC is not only preventive, but may also reverse disease. RIC is true preventive medicine. Key features of RIC: non-invasive, no surgery, no drug side effects, easy to apply, suitable for long-term use, protects multiple organ systems. This perfectly reflects the spirit of ancient wellness. Healing without medicine, preventing illness before it occurs, nourishing before aging. RIC is a modern form of healthcare techniques. To sum up, RIC equals briefly blocking blood flow, triggers protection, strengthens the entire body's organs, reverses disease. It can protect the heart, brain, kidneys, lungs, and intestines, prevent stroke, myocardial infarction, and kidney injury, aid recovery from chronic diseases, promote nerve and heart repair, become a daily wellness practice you can follow. You may have heard the saying, exercise is the cheapest and most powerful medicine. But do you really know what makes it so powerful? Recent scientific research shows us Exercise doesn't just build muscle, it strengthens nearly every organ in the body. It can even prevent, improve, and reverse more than 26 different diseases. Today, let's explore this in the simplest way: how exercise actually strengthens the body, its effects on the brain, heart, lungs, kidneys, and immune system. Why exercise is known as the core tool for whole body optimization. Exercise is the fountain of youth for muscles. Exercise benefits muscles in many ways. Increasing mitochondria, the cell's power plants. Increase protein synthesis. Make muscles bigger and stronger. Prevent or reverse muscle loss, sarcopenia. Increase muscle blood vessel density. Give each muscle fiber more energy. Simply put, exercise is an anti-aging project for muscles. Muscles aren't just about strength, they are a metabolic organ. Muscles store and release amino acids, glucose, myokines, and various ions. These substances influence metabolism, blood sugar, immunity, and whole body energy regulation. So, the stronger your muscles are, the healthier your whole body becomes. Exercise makes the brain smarter and younger. The impact of exercise on the brain is truly amazing. Promotes the growth of new blood vessels. Encourages the creation of new nerve cells. Increases synaptic connections, making brain networks denser. Boosts learning, memory, and concentration. Raises levels of neurotrophic factors, which are like fertilizer for the brain. Studies have even shown that exercise can lower the risk of dementia, Alzheimer's, and Parkinson's disease. Exercise is the most powerful heart protector. Exercise can lower blood pressure, reduce the risk of heart disease and stroke, improve blood vessel endothelial function, strengthen the autonomic nervous system, stabilize arterial plaques, making them less likely to rupture, increase collateral blood flow, the heart's backup vessels, reduce stiffness and heart failure. Studies show exercise can reduce the mortality rate in heart disease patients by 36% to 63%. This effect is difficult to achieve with any medication. Exercise helps you lose weight more easily and stay healthier. Exercise can improve body fat, visceral fat, blood lipids, blood sugar, and insulin sensitivity. These are all key risk factors for metabolic syndrome, diabetes, and heart disease. Exercise strengthens the lungs, kidneys, and immune system. Lungs. Although exercise can sometimes trigger wheezing or bronchospasm, long-term exercise can reduce asthma symptoms, improve cardiopulmonary function, increase lung endurance. This is called lung optimization. Kidney. Research shows exercise can improve physical function in dialysis patients. Exercise slows the decline of kidney function in older adults. Exercise also helps the kidney become healthier. Immune system. Exercise can reduces inflammation, CRP, IL-6, and TNF-alpha levels all decrease. Increases natural killer, NK cells. Increases T cells, stem cells, and endothelial progenitor cells. This means exercise makes your immunity stronger and more youthful. Exercise is a key tool for whole body conditioning. Exercise simultaneously strengthens muscles, brain, heart, blood vessels, lungs, kidneys, immune system, metabolism. It's not just exercise. It is a form of whole body conditioning, a natural therapy that can reverse disease and slow aging. To sum up, exercise equals the most powerful tool for whole body conditioning. It can strengthens muscles, sharpens the brain, protects the heart, reduces the risk of 26 diseases, improves sleep, mood, and stress, delaying aging and extending lifespan. If there were a way to improve all your organs at once, and it was free, had no side effects, and anyone could do it, that would be exercise. Intermittent fasting, not just for weight loss, but a switch for whole body repair. You might have heard the term intermittent fasting, but did you know? And it's not just a method for losing weight. It's a type of physiological stress that activates the body's repair processes, delays aging, and protects organs. Today, let's explore this in the simplest way. So what exactly does intermittent fasting do inside the body? Why does it help the heart, intestines, kidneys, brain, emotions, and immunity? How has it become a core strategy in modern preventive medicine? What is intermittent fasting? Intermittent fasting means not eating or eating very little during certain hours of the day or week, allowing the body to enter a state of nutritional stress. Common practices include eating only within an 8-hour window each day and fasting for the remaining 16 hours. Choosing 1 to 2 days per week to eat only 25% of your usual calories. Alternate day fasting, the 5:2 diet, and similar methods. These methods give the digestive system a temporary rest, while also triggering a series of repair mechanisms. Fasting acts as a stressful stimulus for the digestive system. The main role of the digestive system is nutrient absorption. When you temporarily stop eating, your intestines experience a type of stress, which triggers cell defense mechanisms, self-repair, autophagy, compensatory responses, adaptive adjustments. The result is the intestines become healthier and more vibrant, and can also help strengthen other organs. Fasting not only aids weight loss, but also protects the heart and metabolism. Research shows that intermittent fasting can improve blood pressure, blood lipids, blood sugar, insulin sensitivity, body fat, and visceral fat. These are all key risk factors for cardiovascular disease, diabetes, and metabolic syndrome. Fasting helps you lose weight healthily instead of losing weight weakly. Fasting can also activate the anti-aging mechanism. Intermittent fasting triggers a system called the stress axis, hypothalamus pituitary adrenal axis, HPA axis. This system helps the body to regulate stress, improve sleep quality, stabilize emotions, and enhance focus. At the same time, fasting also boosts brain-derived neurotrophic factor, BDNF, which acts like fertilizer for the brain, promoting neural connections, memory, and anti-aging abilities. Fasting is also beneficial for the intestines. Research shows enhances intestinal movement, improves intestinal symptoms, alters gut bacteria microbiome. This means fasting not only allows the intestines to rest, but also helps them upgrade. Fasting also supports the kidneys, brain, and immune system. Improve kidney function, reduces arteriosclerosis, reduces chronic inflammation and oxidative stress, lowers the risk of cancer and cardiovascular disease. These are all roots of chronic disease and aging. To sum up, intermittent fasting equals nutritional stress activates repair strengthens, organs lowers disease risk. It can helps with weight loss, improve blood sugar, blood lipids, and blood pressure, protects the heart, kidneys, intestines, and brain, boosts mood, sleep, and focus, lowers the risk of chronic disease and aging. This is a true form of preventive medicine. It's also one of the healthiest strategies worth trying today. Conclusion: health can be reversed. The core secret of preventive medicine. You might think, once people start aging, it's all downhill from there. But the latest scientific research tells us aging can actually be reversed. Diseases can be reversed too. And the key lies in a very important concept: hormetic stress. That is, giving the body a little bit of short, controlled, mild stimulation. Why does mild stress actually make the body stronger? When we apply to the body mild, brief, physiological stimulation, for example, exercise, fasting, exposure to cold and heat, indirect cardiac preconditioning, RIC, and so on, the body activates a powerful response, releases protective, healthy factors, eliminates free radicals and other unhealthy factors, triggers cell repair, autophagy, and compensatory responses, improves the extracellular fluid, the body's internal environment. This positive cycle leads to cells becoming younger, improved organ function. The heart even undergoes reverse remodeling. The progression of disease and aging is reversed. This is the core of preventive medicine. It turns out that 2,000 years ago, Chinese doctors already knew this. The famous Eastern Han Dynasty Dr. Zhang Zhongjing once said, "The three main goals of medicine are disease treatment, saving lives, and healthcare, preventing disease and aging." Another famous doctor, Hua Tuo, taught wellness through exercise with the 5 animal frolics. In other words, ancient medicine already understood that the body needs moderate stimulation to stay young. Today, science has simply confirmed this. So what does the science say? Since 1878, scientists have discovered that extracellular fluid, the body's internal environment, determines whether cells stay healthy and live longer. Later studies discovered even more. Culturing tissue with plasma can extend lifespan. The conjoined old and young experiment can rejuvenate mice. Cardiac preconditioning can reverse and remodel the heart. RIC can release protective factors and eliminate harmful ones. These factors can even be transferred across species. All this research points to one thing. Improving extracellular fluid cells become younger, organs grow healthier, aging is reversed. Cardiac preconditioning, RIC, is one of the strongest pieces of evidence. Research shows briefly blocking blood flow in the arm releases heart protective factors, can reduce damage from myocardial infarction, can protect the brain, kidneys, lungs, and intestines, can reduce the risk of sudden death, stroke, and heart disease. Long-term RIC can even help the heart shrink back to its normal size. It improves heart failure, cardiac hypertrophy, and coronary heart disease. These effects are not caused by drugs. It's the body's own repair ability kicking in. This is the power of preventive medicine. Traditional medicine versus preventive medicine, not opposing, but complementary. Traditional medicine treats organs, controls symptoms, provides emergency and life-saving care. Preventive medicine improves extracellular fluid, reverses cellular aging, reverses disease progression. The combination of both leads to the most complete healthcare, especially for hypertension, cardiac hypertrophy, coronary heart disease, heart failure, atrial fibrillation. These diseases are often difficult to fully control with traditional treatments. But after adding RIC, many cases have shown improvement. Future health strategies you can start today. Preventive medicine is divided into two main categories. 1. Traditional wellness for everyone. High-quality proteins, a variety of fruits and vegetables, sufficient probiotics, plus aerobic, anaerobic, flexibility, and balance exercises. Healthy lifestyle habits. 2. Recent wellness, new scientific tools. RIC, wellness blood pressure monitor. Intermittent fasting 1 to 2 times per week. Short-term fluid restriction. Nanotechnology, oxygen therapy, combining modern medicine with alternative medicine. If you keep it up for a year, you'll clearly notice. Your body becomes younger. Your energy improves. Your organ function strengthens. Your disease risk decreases. In short, moderate mild stress activates repair cells, become younger, organs become healthier, disease and aging are reversed. This is the core of preventive medicine and the future path to healthy longevity. Do people truly believe that healthy medicine and RIC can promote wellness? Hurry and purchase a healthy RIC sphygmomanometer to enhance your health every day. Don't forget to scan the QR code. Thank you all for watching. I am Dr. Andrew Ing Shu Lee. Until next time.